बहुत पेरेंट्स ऐसे उनको 2 साल के बाद पता लगता है मेरा बच्चा एडिक्शन में है, और वो सेल फोन में भी काफी ज्यादा लगता है, ड्रग्स में थोड़ा बहुत पता भी लग जाता है, लेकिन आजकल ड्रग्स ऐसे ही हैं उनका पता नहीं लगता। Every parent these days should think that their child can be into the getting hooked into the drugs or cell phone or smartphone addiction। ये अगर हम मान के चलते हैं तो हर एक माता पिता को देखना पड़ेगा बच्चे का रूटीन ठीक है, उसके व्यवहार में कोई फर्क तो नहीं आ रहा, रिसेंटली पढ़ाई तो नहीं नेग्लेक्ट करनी शुरू कर दी, उसने पर्सनल केयर तो नहीं नेग्लेक्ट करनी शुरू कर दी, उसकी जो हॉबीज थी उसको तो नहीं नेग्लेक्ट करना शुरू हुआ, इरिटेबल हो गया, चिड़चिड़ा हो गया, घर से वो पैसे कुछ ज़्यादा स्पेंड कर रहा, ज़्यादा यूज़ कर रहा, लेट नाइट आ रहा है घर पे, या वीकेंड पार्टीज में बहुत रेगुलरली जाता है। इट इज़ द रिस्पॉन्सिबिलिटी ऑफ टीचर्स, फैमिली मेंबर्स, police people, judiciary, and of course the government itself. So everybody will have to work in their respective areas. Then only probably this day by day expanding disaster in disaster situation, this can be controlled.
Hello everybody, welcome to yet another episode at 2 for Joy Studio, and today we are trying to cover one of the very pressing issues that is being faced in the society, and that is double jeopardy, drug addiction and mobile addiction. Throw light on the same. We have Dr. Ravi Sharma. He's a retired professor from the Indira Gandhi Medical College. He retired as the Director of Medical Education. And the foresights that he has, going to share them with us today with respect to drug and mobile addiction. So welcome to the show, sir.
Thank you, Paras. I am quite happy today that 2 for Joy has invited me to deliberate upon a topic which is so very important these days for the youngsters also, and in fact for each one of us.
Right.
And I am quite hopeful that the message we'll deliver shall go into the public.
Absolutely.
Nicely.
That is our endeavor, and we'll make sure that that percolates. First, like to start with a small question. In the context of double jeopardy, when the mobile and the drug addiction is happening together to an individual, how do you foresee the prospects of this particular jeopardy that is happening in today's world? What are the implications on the society, and what are the implications on the subject who's doing this?
Yeah, I think a very pertinent topic these days, and rather a very burning topic also. Earlier on, we used to talk about youngsters getting into the grip of drug addiction and various other kinds of substances, drugs, alcohol, tobacco, and various other chemicals also. But now, ever since cell phones and especially the smartphones have come into use, there has been a tremendous change in the use of these phones, primarily because they are connecting you globally. You are not connected to a particular area, you are connected to the whole world. So
Correct.
You are connected to the social media, you are doing the internet, Facebook, emails, Twitters, and whatnot. So habit is getting ingrained in youngsters to not to stay away from these gadgets.
Yes, sir.
And they are becoming compelled to use these gadgets, and even if they try also, they are unable to stay away from this.
Right, sir.
So then it is becoming a sort of a double problem for these people. But the difference is, for example, if somebody is taking drugs and other substances, so it is basically some chemical you are putting into your body. And your whole body is getting addicted to it, and your mental aspect is also affected, social aspect is also affected. But in this case, you have got a small gadget in your hand in the form of a small smartphone, and you are unable to get yourself away from that.
Jesus.
And this compulsion is so strong, or rather equally strong, as it is towards the drugs. So now you can say that you have two enemies now. One is inside in the form of a drug or chemical, and another one is in the form of a behavioral compulsion which you can call as a internet addiction or a smartphone addiction also. So obviously the impact has to be going to be very strong and severe.
You would be getting a lot of patients who are struggling with both these addictions together. So how do you face those challenges, and what is your recommendation for such people in the future?
फर्स्ट ऑफ ऑल आई थिंक जो समझने वाली बात जो है वो ये है कि क्या हम जो ये स्मार्टफोन्स हैं या जो हमारे पर डिजिटल जो माध्यम हैं जिनके से हम कम्युनिकेट करते हैं या सोशली कनेक्ट करते हैं, इनके बिना गुजारा नहीं है.
Right.
This has become very essential component of our life. But the thing is, what is the limit?
What is the
where you have to limit? You cannot, nobody can stay away from the use of this digital technology, whether it is in the form of making certain payments or connecting to people or doing some home assignments for the students and corporate sector and all other areas,
Right, sir. Right, sir.
But the thing is, when we overstep that or we venture into those areas, when it becomes excessive and you are unable to come out of that or you are unable to restrict that, right?
Right.
And it is telling upon your physical, mental and social health. And you are neglecting all your social responsibilities. If the child is there, he is neglecting his studies. If it is another youngster in the college, he is also not bothered about his studies. Then if it is your job, you are not worried about your job, finances.
Very true.
And if it is a lady in the home, she is also not worried about her children and family affairs. So the whole social fabric and social connectedness
has been impacted.
Has been adversely impacted.
Ji.
Then it becomes a sort of a matter of concern, and you can call it a smartphone addiction or in a common term, a behavioral addiction to the gadgets.
Right, sir. So since you've been talking about the age groups and different strata in the society, so when you look at double jeopardy, that is mobile and drug addiction, what age groups do normally come to you in this category?
Paras, the thing is that, there is a inquisitiveness in a child. The moment you start coming into the contact with the environment, तो आपकी एक इच्छा होती है ये क्या हो रहा है, ये कैसे हो रहा है, तो दैट इंक्विजिटिव बिकॉज योर ब्रेन इज ग्रोइंग,
राइट सर.
तो उसकी वजह से क्या है कि आपको पहले तो अपनी मम्मी होती है, फिर फ्रेंड्स होते हैं, घर में दूसरे लोग होते हैं, जैसे आप स्कूल जाते हैं तो देयर आर चिल्ड्रन ऑल्सो एंड अदर थिंग्स ऑल्सो.
जी सर.
अब सोशल मीडिया ने इतना ज़्यादा इंट्रूड कर रखा है हमारे घरों को, हर एक आदमी यूज़ कर रहा होता है घर पे भी, तो उनकी जो इंक्विजिटिवनेस, एक नया जानने की जो इच्छा है, उनकी वजह से यंगस्टर्स में, एडोलेसेंट्स एंड स्टार्टिंग फ्रॉम टीन्स, सो टीन से शुरू होकर एडोलेसेंट्स में, दे आर सीवियरली इनटू द ग्रिप ऑफ दिस.
राइट.
Now they are finding so many things, so much information on the smartphones that they know about drugs also. Now, somehow, either they are from the peer group, invariably they come to know about various drugs and they start experimenting them. Then now the thing is that they can procure also. There are many drugs you can procure online.
Oh my
so there
goodness.
is, in fact, no restriction.
I see.
And later on they come to know that I have become dependent upon it. The moment the individual has become dependent upon it, these youngsters, because their mind is not properly grown, they are not fully mature. It is growing, but it is not fully mature. Mature means that they cannot think what is good, what is bad. अपना अच्छे और बुरे के बारे में उनको समझ नहीं रहती. So they are getting, badly into this habit.
In your experience, what are the most effective strategy to treat this dual addiction that we are talking about today? Do we segregate them and treat them individually, or is there a way to treat them together?
If somebody is having both the things together, so first of all, I think we would like to control the drugs because that is a rather more serious and severe condition.
Right.
Because it is telling directly upon your health, and there is a chance of fatality also. You can even die also.
Right.
So that is a very serious issue. So first of all, we have to see what kind of a drugs it is.
Right, sir.
Earlier on, it used to be only, initially it used to be tobacco. Then we came on to the cannabis, bhang, charas, sulfa, उस तरह की चीज़ें स्मोकिंग के साथ. दूसरी चीज़ें आई, अल्कोहल इन वेरियस फॉर्म्स youngsters used to take. But lately, or rather for the last 15 years or so, maybe 20 years even, ये जो चिट्टा या जिसको हम हेरोइन टाइप जो बोलते हैं नार्कोटिक्स which
Right.
are harder drugs, and just analog of that party drugs which are stimulants mostly, vitamins, ecstasy and all those drugs, LSDs,
Right, sir.
ये इनका यूज काफी ज्यादा हुआ है. So you have heard of those rave parties and all.
Rave parties,
So what
yes, sir.
happens in rave parties is basically these drugs, they are used in plenty. And the connection, of course, is always through your gadgets, cell phones and the internet and social media connections.
Right, sir.
So they are hand in glove there. So depending upon what kind of a drug the individual is taking, we have got a strategy for detox.
Right,
That's
sir.
called a
Right, sir.
detoxification regime. And what is more important is afterwards, that the individual has been detoxified from the substance or the drug he or she is taking.
Very important, sir.
Then simultaneously we talk to the family members also, we do
Right.
the counseling also of the individual,
Right.
and then we involve them into rehabilitation component. And that is called as a relapse prevention program also, that we want that once the individual has been made free from these substances or drugs,
Ji, sir.
he should not again get back into it.
Right, right.
So
That is
continuous monitoring and remaining in touch with the family members and asking the individual to follow up with the hospital authorities. Invariably, I mean, we have got the phone numbers of all these people whom we treat.
Ji, sir.
And if they don't come for follow-up also, we call them also. Because as you said, now also I am into this practice of psychiatry. So in our clinic and otherwise the people who are getting admitted also, we remain in touch with them.
Right.
And we have asked their parents also that to remain in touch with us and follow the the follow-up religiously, so that we don't allow the individual to again go back into that substance or drug addiction.
Right, sir. Right, sir.
We do a detailed analysis of the individual physically
Ji, sir.
and psychologically also. If there is a physical derangement like hepatitis C is a very common thing, because these people, they take these drugs intravenously.
Right, sir.
So we seek consultation from hepatology department or gastroenterology department.
So
also.
multiple people take
Yes,
the
yes,
the
interest.
Yeah.
And it is a multi-pronged strategy to treat them. And many disciplines, it's not only that psychiatrists treat, but as far as the psychological aspect is, that only we are dealing with.
Right, sir. Right.
So supporting, strengthening and rectifying is physical aspect, and then strengthening psychological aspect, we treat the individual.
Right, sir.
So that is the main aim as far as the drugs are concerned. Now if the individual, we are saying that it is a behavioral addiction or that smartphone addiction also, ऐसे लोग हमारे पास थोड़े कम आते हैं, बिकॉज ये प्रॉब्लम नहीं होती, बिकॉज शारीरिक तौर पे ग्रॉसली कुछ नहीं लगता.
Yeah.
इंडिविजुअल का जो एक डिस्फंक्शन होता है, या बच्चा पढ़ाई में पिछड़ रहा है, या वो उसकी आदतें गलत हो रही हैं, या लेट नाइट आ रहा है, या पार्टीज में जा रहा है,
जी सर.
तो वो डायरेक्टली उनको कंसर्न नहीं होता, माता पिता को पता भी नहीं लगता है.
सर, आई वुड लाइक टू ऐड ऑन टू दिस एस्पेक्ट. आजकल मैं देख रहा हूँ सर कि स्कूल्स में इवन होमवर्क तक वो मोबाइल फोन पे दे रहे हैं.
हाँ, वो ये.
Do you think that is a good way
This is
to-
very important. This is very important. There is, you cannot think of living without these gadgets, electronic gadgets, primarily smartphones or maybe your laptop or PCs, So because you have to remain connected globally.
Right,
And
sir.
you have to make assignments, you have to be in touch with all over the world also, and with the latest developments
हाँ
also.
जी, हाँ.
So people hardly use books these days, except for the textbooks and all that. For latest information, if you want to get and if you want to prepare your seminar and paper presentations, if you want to write a paper also, you have to take the projects also for the students.
Ji,
you have
sir.
to take the help of these gadgets also. But what is important is that it is the duty of the teachers as well as the parents also to set a limit,
So
to
that-
restrict. That is most important. If we fail to recognize that limit, or if we just ignore that and we say the child is busy with the homework, he may not be busy with the homework. Or rather, he may be rather neglecting his homework. He may be busy with some other interesting
Anything.
programs.
Yeah.
So that has to be seen, and everybody must know it.
Right, sir.
So how to set that limit and where to set, that is very important.
According to you and according to psychology, what do you think is a good time period in a day for using your mobile phone?
Right.
हाँ.
Setting limit means there are few things like you are taking a dinner, you are going to the toilet, you are going to the gym, If somebody is going for a morning walk, you are doing some kind of a jogging or some exercise at home, you should put off or rather switch off your all gadgets. There is no point. You are, if there is say family members, we are talking about household people, if they are sitting with their family members also, everybody should switch off.
Because
you should stack your mobiles at a particular place that nobody will use. So this discipline has to arise somewhere.
And that has to be a family thing.
It has to be generated, because without that, if suppose father or mother is busy in a corner doing all that, how can you expect your child to stop or restrict the use of mobile phone?
Absolutely.
Now another thing which is very interesting is that small children are there, mother is busy somewhere, or maybe there is a housemaid also kept for that particular purpose. She will give a mobile to the child, and he will fiddle with the mobile, and you cannot take that mobile from the child.
You can't.
Because the child finds that mobile very interesting. So जाने में कहीं ना कहीं हम बच्चों को खुद भी थोड़ा सा इस टेक्नोलॉजी या मोबाइल फ़ोन या सेल फोन की तरफ जो है एडिक्शन की तरफ प्रेरित कर रहे हैं.
The society at large, teachers, parents, and all individuals, what is your message to them, especially in terms of this double jeopardy? We can take it separately, mobile addiction and drug addiction, but there has to be some message from the core of your heart, sir.
My message is that every parent these days should think that their child can be getting hooked into the drugs or सेल फोन और स्मार्टफोन एडिक्शन. ये अगर हम मान के चलते हैं तो हर एक माता पिता को कुछ डूज एंड
दे हैव टू हैव
डूज एंड डोंट्स. उनको देखना पड़ेगा बच्चे का रूटीन ठीक है, उसके व्यवहार में कोई फर्क तो नहीं आ रहा. रिसेंटली उसने अपनी पढ़ाई तो नहीं नेग्लेक्ट करनी शुरू कर दी, उसने पर्सनल केयर तो नहीं नेग्लेक्ट करनी शुरू कर दी, उसकी जो हॉबीज़ थी उसको तो नहीं नेग्लेक्ट करना शुरू हुआ, इरिटेबल हो गया, चिड़चिड़ा हो गया, घर से वो पैसे कुछ ज़्यादा स्पेंड कर रहा, ज़्यादा यूज़ कर रहा, लेट नाइट आ रहा है घर पे, या वीकेंड पार्टीज़ में बहुत रेगुलरली जाता है. वेयर इज़ ही गोइंग? जब तक हम इसमें एक साइलेंटली इसके ऊपर एक सुपरविजन नहीं रखेंगे, यू विल नॉट कम टू नो दैट योर चाइल्ड इनटू ड्रग एडिक्शन. Cell phone, of course, is something which is done in front of you. He says that I am doing homework, he may be doing it. तो उसको करने के लिए तो what we have to do is that you have to have a common area that everybody uses cell phone here or other
switch off the Wi-Fi.
No, you switch off, and this is the place where you have to use. Maybe for 2 hours you have to use it. So you make your preparation, then switch it off and go away. So that is to be done. But if the child is taking the phone to the bed also, and there is a message and the child is jumping in the bed also, that message has come, and also he will have very deleterious side effects upon his mental and physical well-being.
Right, sir.
तो ये तो हमें इसके लिए एक सुपरविजन रखना पड़ेगा. बहुत पेरेंट्स ऐसे उनको 2 साल के बाद पता लगता है, 1 साल के बाद पता लगता है मेरा बच्चा एडिक्शन में है.
जी सर.
और वो सेल फोन में भी काफ़ी ज़्यादा लगता है, ड्रग्स में थोड़ा बहुत पता भी लग जाता है, लेकिन आजकल ड्रग्स ऐसे ही हैं उनका पता नहीं लगता.
अच्छा जी.
वाइट क्रिस्टलाइन पाउडर थोड़ा सा आंखों में रेडनेस होगी, व्यवहार में चेंज होगा, लेकिन एज वेच पहले कोई अल्कोहल की स्मेल या वो कैनाबिस वाली चीज़ें, वो ये जो दूसरी ड्रग्स हैं जो हार्डर ड्रग्स हैं, इनसे ऐसा कुछ ज़्यादा नज़र नहीं आता.
अच्छा सर.
है ना, बस वो व्यवहार और वो गुस्सा, पैसे घर के निकालना या अपनी सोशल ऑब्लिगेशंस को जो है वो निगलेक्ट करना, उस तरह की चीज़ें नज़र आती है जिसको हम छोड़ देते हैं, वैसे ही हम उनको लेते हैं. तो ये दोनों चीज़ों को देखना पड़ेगा. और मैंने जैसे हमने कहा भी है कि ये मान के चलें कि मेरा बच्चा भी इस एडिक्शन में जा सकता है अपने पीयर ग्रुप की वजह से. कभी कभी हम कहते हैं माता पिता बहुत अच्छे होते हैं, इनको बाद में पता लगता है यार मेरा बच्चा भी इस एडिक्शन में चला गया हुआ है. तो ये मान के रखेंगे तो हम बच्चों को इसमें जाने से रोक सकते हैं. और जैसे ही आपको पता लगता है कि बच्चा इसमें चला जाएगा, तुरंत उसके लिए एक आप काउंसलिंग लीजिए. इवन स्कूल और कॉलेज में काउंसलर्स होते हैं, उनके थ्रू भी आपको उनके संपर्क, पेरेंट टीचर मीटिंग को मैं अक्सर बोलता रहता हूँ, उसमें आप पूछो मेरे बच्चे में कोई ग्रेड्स तो नहीं लो हो रहे हैं, पढ़ाई में पीछे तो नहीं रहा, इसके व्यवहार में चेंजेस तो नहीं है, है ना.
These are the questions which the parents should ask the teacher.
Yes. कोई इसमें आपके पास एग्रेशन या इस तरह का बंकिंग क्लासेस ऐसा कुछ तो नजर आ रहा. बट इफ वी जस्ट से सी द ग्रेड्स कि ठीक है यार चल पड़ेगा, देन दैट मींस वी आर ओवरलुकिंग इट.
Alright, sir.
Right? These are to be seen. You can check your rooms of your children also. Why is he casually? Not that I want to check for drugs. You see whether there is abnormal smell, abnormal substances, small packets, syringes and otherwise which do not have any role
in the room
of a child. I think that should give you a strong suspicion. Child is spending a lot of time in the toilets and secluded places and these weekend parties. I think you should be vigilant.
Right, sir.
What is his friend circle? Who are these peer groups? Do you meet their parents? Do you know these children? Suddenly one day you know that my child has been spoiled by X child.
Absolutely.
All these things अगर हम करेंगे तो मैं कहता हूँ ऐसा नहीं है कुछ भी, आप बच्चों को इसमें जाने से रोक देते हैं. एक बार बच्चा जब चला गया है तो थोड़ा उसको मुश्किल है, असंभव नहीं है. You can bring him back. लेकिन उसमें भी as early as possible आप बच्चे को जो है वो काउंसलिंग दीजिए. अगर परिवार के लेवल पे सब कुछ बात बन जाती है, कोई बड़ा है परिवार में या कोई ऐसा व्यक्ति है जिसको आप इम्पोर्टेंस देते हैं, कई लोग होते हैं परिवार में, चाइल्ड ऑल्सो गिव्स इम्पोर्टेंस. इफ दे आर नॉट देयर देन यू सीक प्रोफेशनल काउंसलिंग. ज़्यादातर लोग हेल्प नहीं लेते.
अच्छा. And is that a taboo in the society?
Yes, that is still a taboo because सबको पता लग जाएगा ये बच्चा साइकियाट्रिस्ट के पास जा रहा है या इसको नशे की समस्या है.
जी.
I think everybody should try to get a help.
Absolutely.
Online help and consultation is available. लेकिन वो एक जो क्रेडिबल सोर्सेज है आप वहीं से लें तो ज़्यादा अच्छा है.
ठीक है सर.
टेली काउंसलिंग के जरिए भी आप अपनी समस्या बता सकते हैं, बट दे इनवेरिएबली गाइड यू टू सर्टेन सेंटर्स और प्लेसेस कि आप फलानी जगह जाके अपनी डिटेल में ट्रीटमेंट करवाओ. तो मेरा तो यही संदेश है, नशा मुक्त जीवन या सेलफोन को जो है एक गाइडेड तरीके से और गार्डेड तरीके से यूज़ करना जो है वही, उसी के साथ हम अपने बच्चों की और अपनी तरक्की कर सकते हैं. अदरवाइज फिर इसमें नुकसान ही है.
So there has to be regulations in the mobile.
Yes.
We would like to know a little bit about the pathophysiology and what is actually happening inside the body for the kids to understand that when they get into addiction, like the naughty drugs, I would like to call them, the LSD, the heroin and chitta and all these medications, what is happening to them internally?
Basically, drugs do not have any place in the body. They are not required.
Right.
There are certain, for example, cannabinoids we call it. Cannabis का कुछ उसी तरह की चीज़ें होती है, या opiate receptors हैं तो opium like substances body में निकलते हैं तो हमारी internally body pain को कम करते हैं.
Right.
तो वो nature has made that, लेकिन अगर हम बाहर से इन चीज़ों को लेंगे तो हमारी body इसके प्रति जो है वो addiction में चली जाती है. Because कॉमन सी चीज़ है, आप किस चीज़ को पसंद करते हैं उसको आप बार बार करते हैं.
जी सर.
तो एक चीज़ को लेके जब आपको थोड़ा ग्रेटिफिकेशन होती है, यू फील इलेटेड और यू फील हैप्पी एंड यूफोरिक टेम्पररली, यू वांट टू हैव दैट टाइम एंड अगेन, बट इट इज़ नॉट ए सस्टेन्ड थिंग. People forget, youngsters forget. I said that they are not mentally so mature to understand कि it's not going to be a sustained kind of a thing. और उस थोड़ी सी खुशी को लेने के लिए, enjoyment को लेने के लिए, you are putting your whole body
life at
risk. लाइफ इज एट रिस्क.
राइट.
तो जैसे हम कोई चीज़ लेते हैं डिपेंडिंग अपॉन, वैसे चाहे स्मोकिंग करते हैं या अल्कोहल लेते हैं या ड्रग्स लेते हैं, एक सेंटर होता है प्लेजर सेंटर बोलते हैं, वेयर यू फील द प्लेजर. डोपामिन निकलती है, एक हार्मोन है, पॉजिटिव हार्मोन, जिससे आप अच्छा खुश फील करते हैं.
जी.
डोपामिन तब भी निकलती है जब आप किसी अच्छे दोस्त से गपशप मारते हैं, अच्छी कोई चाट खाते हैं, रसगुल्ला खाते हैं.
So it gives you a parallel effect.
Yes, it's a good effect, and you feel क्या मजा आ गया, आज तो बड़ा अच्छा लगा. So जब ये चीज़ें आप लेते हैं तो डोपामिन रश बहुत ज़्यादा होता है, बहुत ज़्यादा निकलती है, और वो ज़्यादा निकलने के चक्कर में आप उसको बार बार लेना चाहते हैं. अब एक रसगुल्ला खा लिया, चाट खा लिया, कुछ खा लिया तो थोड़ा मॉडरेशन में निकलेगा. लेकिन जब आप ड्रग्स लेते हैं, बिकॉज दे डायरेक्टली एक्ट एंड दे इंक्रीज दैट अमाउंट क्वाइट अ लॉट,
दे आर वेरी पोटेंट.
इट गेट द ब्रेन गेट्स फ्लडेड विद दैट and you want to have that excitement and enthrallment, time and again. वो जो एक gratification आप बार बार, और कुछ ड्रग्स इतनी स्ट्रॉन्ग है कि अगर आप 5, 6, 8 पॉप्स ले लो, you will have a strong urge to have that particular thing again, because your body will show throw withdrawal symptoms, restlessness, irritability, insomnia, nausea and vomiting, and अजीब सी एक बेचैनी होनी शुरू हो जाती है. So the moment you will take that again, the things will settle, normalize. तो ये जो vicious cycle एक बन जाता है.
That's a very very deadly.
That is physical. Now psychologically you want to have that pleasure time and again. That is psychologically. तो ये जो vicious cycle बनता है, ये उस एन्जॉयमेंट को बार बार करने के लिए बनता है, जो आउट ऑफ योर इमेच्योरिटी और इग्नोरेंस और वट एवर यू डोंट नो दैट नहीं मैंने ऐसा नहीं करना है या मैंने इसको छोड़ना है, तो आप उसके ट्रैप में या यू गेट हुक्ड ऑन टू द ड्रग्स एंड सब्सटेंसेस. अगर सेल फोन का लें,
जी,
Cell phone mein you are not injecting anything, but psychologically you are finding enjoyment in that. You are gaming, you are having certain games also, or maybe various kinds of things. You are even adult people go into pornography and all those, and those things which somehow give you gratification. You are doing it in secluded place. Nobody is watching. So you are seeking that enjoyment time and again. And if you do not have that understanding, again you get hooked onto that also. Though it is not a drug.
Very true.
But you want to go into the enjoyment of that particular thing.
So, sir, एक balanced level of dopamine in the body is there.
Yes, that is required.
Which is required.
That is required.
But when you push it too much,
yes.
then will it affect the organs of the human?
It will affect your whole brain, and ultimately your brain becomes a slave to these drugs, and it will literally, the neurons cry for that substance.
Right, sir.
The moment you do not have that, depend करता है. आप जैसे टोबैको आप 6 hours के बाद आपको तलब लगेगी, या अल्कोहल को 6 से 8 घंटे के बाद आपको लगेगी. So the neurons literally cry for that. Give me more, give me more. So you feed it and they are again relaxed. Then after a particular time, जब उसका impact खत्म हो जाता है, आप उसको दोबारा करना पड़ता है. तो आपने अपनी बॉडी को एक स्लेव बना दिया.
जी.
अब ये स्लेव जितनी जल्दी आप समझेंगे कि मैं स्लेव बन रहा हूँ, मैंने बाहर निकलना, तब तो ठीक है. अदरवाइज यू आर गेटिंग डीप इनटू दैट स्लेवरी.
Vicious cycle.
Yes. एक जो कटिंग अवे फ्रॉम रियलिटी.
Right.
Going into a virtual world. आप hallucinogens, LSDs and amphetamines वगैरह लेते हैं तो आपको थोड़ी देर के लिए ऐसा लगता है कि मैं दुनिया से कट ऑफ हो गया. All my miseries are gone and all unhappiness is gone.
Right.
That is just transitory. Later on, you don't remember also. And many times, in party drugs and all those things, they are called as rave drugs. तो उसमें तो white crystalline substances, if you mix into those
cold drink,
crystalline what cold drink also, any kind of criminal activity can also go. Even girls can be spoiled also and all those things. लेकिन अगर आपको ये नहीं पता लग रहा है कि यार रियल वर्ल्ड का क्या मतलब है. We are social animals. We need to have social relationships.
Right, sir.
And if you are going to be a virtual person, how far you can stay into
what
that
is the
world,
point,
है ना. So ये चीज़ मैं समझता हूँ सभी को अंडरस्टैंड करने की जरूरत है कि किसी भी ड्रग से, कोई ऐसी ड्रग नहीं अभी तक बनी है जिससे आपका डिप्रेशन दूर होता. मैं नशीले पदार्थों की बात कर रहा हूँ
जी.
या आप हमेशा खुश रहते हैं या खुश ही रहेंगे, जैसे उसका टेम्पररी इफेक्ट यूफोरिया या जो आपको लगती है कि मैं दुनिया से कट ऑफ हो गया, वो टेम्पररी जब हटता है, उसके बाद के जो साइकोलॉजिकल कंसिक्वेंसेज है, दे आर मच मोर सिवियर and they are literally
disastrous,
deadly,
right, sir.
और उसके लिए फिर आपको दूसरी ट्रीटमेंट लेनी पड़ती है.
right.
Now the question is that अगर आप इसमें ट्रैप हो गए, there is nothing to be frightened of. The only golden rule is जहाँ आँख खुले वहीं सवेरा. जहाँ से आपको लगता है कि मैंने अब नया जीवन शुरू हो रहा है, you take a pledge that I have to go to the counselor, I have to go to the psychiatrist, to seek consultation. Get yourself rid of it.
और आजकल तो शायद ऑनलाइन भी psychologists.
Yes, online also there are various call centers and people are providing counseling and help strategies also they suggest. But I think what I feel personally is that if you have got in a real relationship, you find some therapist, that is more important. So, all the parents, I think it is their it's advice for them that they should, if they come to know that unfortunately their child is into this, they should immediately seek help. They should not shirk. They should not have that stigma कि नहीं यार सबको पता लग जाएगा. Suddenly, if you lose your child, फिर नहीं पता लगेगा.
That is a
अगर हम दिमाग में रखें और तुरंत अगर इसके लिए एक सहायता लें, मैं समझता हूँ तो बहुत कुछ किया जा सकता है.
Right, sir.
It is not impossible. It may be difficult, but it is not at all. There is a treatment available. There are strategies available, and everything is available. The moment we have treated many people, they are living good lives and they are productive people also. But probably they had come little earlier, or even if there were many, they come little earlier, late also. Even then, they are put into the social stream and they are fully rehabilitated. Nobody can say that ever they must have been even addicts.
थोड़ा सा मैं आपसे जानना चाहूँगा सर कि जो ऑर्गन अफेक्ट होते हैं इवेंचुअली ओवर अ पीरियड ऑफ टाइम व्हेन यू आर टेकिंग दीज ड्रग्स, सो देयर इज अ इम्पैक्ट ऑन लंग्स, देयर इज अ इम्पैक्ट ऑन हार्ट, देयर इज अ इम्पैक्ट ऑन लिवर, मल्टीपल ऑर्गन्स इन्वॉल्वमेंट. द पर्सन रियलाइजेस दैट this is probably not the right way to go, and then वो एक डॉक्टर से मिलते हैं. What is the treatment modality, sir? And ये जो total length of the treatment है, ये कितना रहता है, sir?
आमतौर पे जैसे ड्रग्स अगर कोई ले रहा है तो उसमें तो ज़्यादातर क्योंकि फिजिकल एस्पेक्ट इन्वॉल्व है तो विथड्रॉल सिम्टम्स वगैरह होते हैं, तो वो एक डिटॉक्स ट्रीटमेंट होती है जिसको डिटॉक्सिफिकेशन बोलते हैं. यूजुअली 2 हफ्ते चलता है, मे बी 4 वीक्स ऑल्सो, बट आमतौर पे 2 हफ्ते में वो कंक्लूड हो जाता है.
जी.
बहुत सीवियर हो तो थोड़ा प्रोलॉन्ग कर सकते हैं. तो उसमें हम वीन ऑफ करते हैं इंडिविजुअल को उन ड्रग्स से, या उसी तरह की थोड़ी दूसरी जो अप्रूव्ड ड्रग्स हैं सिंथेटिक वो दे के, या दूसरे कोई सिम्टोमेटिक ट्रीटमेंट करके. साइमल्टेनियसली हम उनका फिजिकल असेसमेंट करवाते हैं डिटेल में, लीवर, किडनी एंड लंग्स एंड ऑफ कोर्स ब्रेन एंड हार्ट.
राइट सर.
प्लस उनका जो हेमाटोलॉजिकल सिस्टम है सेल्स में, और दूसरी चीज़ें मेटाबॉलिक पैरामीटर्स. तो आमतौर पे जैसे मैंने कहा कि इंजेक्टेबल ड्रग्स अगर कोई ले रहा है तो लिवर इज द ऑर्गन विच इज इनवेरिएबली गेटिंग अफेक्टेड, एंड हेपेटाइटिस सी इज वेरी कॉमन इन people who take
even HIV for that matter.
HIV, yes, another is HIV we are finding in people, even hepatitis B also.
Ji.
So all these blood-borne infections can go. And simultaneously, these people may be involved into some other sexual things also. So they can have those things also, perversions also. तो एक complicated सा issue हो जाता है.
जी सर.
तो हम जो liver का aspect है तो हम gastroenterologist या hepatologist उनको loop में लेते हैं.
ठीक है सर.
और lungs का जैसे primarily smoking या cannabis या इस तरह की चीज़ें जो inhale जो करते हैं आदमी, उनके lungs की assessment बड़ी अच्छी ज़रूरी होती है करवानी, तो हम lung की assessment करवाते हैं. किडनी की फंक्शंस टेस्ट करवाते हैं, और जो इंजेक्टेबल लेते हैं उनका तो सारा बॉडी इफेक्ट हो जाती है.
जी सर.
इंजेक्टेबल हार्ट में डायरेक्टली इन्फेक्शन चला जाता है, स्किन में इन्फेक्शन जाता है, सबक्यूटेनियस टिश्यू में जाता है, तो इन्फेक्टिव एंडोकार्डाइटिस उसको बोलते हैं, तो वो उनको बाद में पता लगता है कारण तो वो तो इंजेक्टेबल ड्रग्स की वजह से हुआ. सारे शरीर में सेप्सिस हो जाती है. तो सेप्सिस को कंट्रोल करने के लिए अप्रोप्रिएट मेडिकल ट्रीटमेंट जो है हम लेते हैं, लोगों से इनकी सलाह लेते हैं, और एक सारे जो मल्टी डिसिप्लिनरी टीम में उनकी ट्रीटमेंट करते हैं.
ठीक है.
जहाँ तक साइकोलॉजिकल एस्पेक्ट है, बिकॉज एडिक्शन इज इन द माइंड.
राइट सर.
सो वो एक साइकियाट्रिस्ट पकड़ता है.
ठीक है.
फिजिकल असेसमेंट तो दूसरे लोगों से करवा के उनका भी इनपुट लेके उस व्यक्ति को, उस इंडिविजुअल को, वी गेट हिम थॉरली ट्रीटेड.
Right. So
and
it's
we
a
give him a feedback.
Multifaceted approach.
Yes, we give him a feedback and tell him that let this be the first and last time. If you do it again, next time the chances will be severe.
Even more severe.
Yes. तो एक बार अगर कहीं unfortunately हो गया है तो try to control and contain it. You may not have it again. हेपेटाइटिस सी वगैरह काफ़ी हद तक लोगों में अच्छा रिस्पॉन्स आता है, बट इफ़ यू डू इट रेपिटेटिवली देन इट कैन डैमेज योर लिवर ऑल्सो.
राइट.
अल्कोहल है, अल्कोहल से तो आपको पता ही इतनी सारी चीज़ें, लिवर ख़राब होता है तो हेपेटिक फेलियर तक हो जाता है, फैटी लिवर हो जाता है, हेपेटाइटिस हो जाती है ना, गैस्ट्रिक अल्सर्स होते हैं, ऑसोफेजियल कैंसर होता है, कितने कैंसर अल्कोहल की वजह से.
जी जी.
राइट. न्यूरॉन्स में गड़बड़ी होती है, ब्रेन में श्रिंकेज हो जाती है, तो ब्रेन में तो खैर बहुत ही ज़्यादा साइड इफेक्ट्स हैं, इवन डिमेंशिया तक चीज़ें हो जाती है. सारी ड्रग्स ब्रेन को निष्क्रिय बनाती है, तो यू बिकम ए डम्ब काइंड ऑफ इंडिविजुअल हु इज़ वेरी इंटेलिजेंट अदरवाइज. वो एक अपने को सोसाइटी से कट ऑफ सा हो जाता है, और अल्टीमेटली फिर तो वो बोलता है कि मैंने तो नशा ही लेना, बिकॉज ही इज़ नॉट इन टू दिस सोसाइटी.
Is all right.
You have depleted, you have deregulated the neurotransmitters which are normal in the brain, normally secreted, by taking these substances time and again.
Right, sir.
So you can think that what kind of a social life, mental life the individual is going through.
Absolutely. So
anxiety, depression, suicidal tendencies, and all these things, these are the consequences apart from, physical aspects.
So long term में sir, for such individuals who are already addicted, उनका long term like 1 year, 2 year, 3 year, what is the graph like? Is it
Yes. The thing is, I told you that usually 2 weeks we take, 15 days, 14 days, Thereafter, we follow them regularly. Initially, maybe 7 days, then 14 days, then maybe 4 weeks and all that. We remain in touch with them. But by and large, it has been seen that somebody stays away for 6 months or so, the prognosis is quite good. If it is
Very
6
nice.
years, 1 month, 1 year, that means another 6 months, then again the prognosis is quite good. By that time, we inculcate all those habits into the individual, and we make him socially connected so well and into his profession and studies and other things that he also thinks that probably the life without drugs is quite better.
We would like to touch upon the role of the government in the current scenario.
Yes.
We would also like to be aware of the various rehabilitation centers that are being opened and are already open. What is the status and how can one go into rehab? What is the process so that in the future they don't have these complications?
Basically, treating people who are into any kind of addiction, primarily drug addiction if you are talking, because behavioral addiction can otherwise be treated in hospitals also.
Ji.
There are two ways, One is hospital run the addiction centers or the addiction services. Primarily the psychiatrists, they provide these services. Basically, मैंने जैसे कहा आपके भी एक तो शॉर्ट टर्म ट्रीटमेंट है, डिटॉक्सिफिकेशन जो हम करते हैं कि 2 हफ्ते लगते हैं इनवेरिएबली, लेकिन लॉन्ग टर्म ट्रीटमेंट ज़्यादा ज़रूरी है ताकि वो दोबारा जो उसमें दोबारा नहीं जाए. तो उसके लिए आपको यू मस्ट हैव सम काइंड ऑफ ए रिहेबिलिटेशन सेंटर. मैनी टाइम्स वी हैव ड्रग डी एडिक्शन एज वेल एज ए रिहेबिलिटेशन सेंटर टुगेदर ऑल्सो.
अच्छा सर.
So at government level, basically all medical colleges in the state, 6 government colleges, 1 private medical college, they are providing de-addiction services. But the dedicated de-addiction center that is at Maharishi Markandesh Medical College, Indira Gandhi Medical College, in fact, also has got a de-addiction setup. Apart from that, for my knowledge, as it was earlier until now, there is not separate dedicated de-addiction center. Because separate de-addiction center is the need of the hour, where primarily these people are looked after, and there is no stigma also of being treated with the other psychiatric patients also. Many people may resist for that.
Right.
Then as far as the rehabilitation center are concerned, they are primarily run and managed by Social Justice and Empowerment Department.
Right.
Because ours is a health department, which is in the medical colleges and otherwise. Social Justice and Empowerment Department is providing rehabilitation centers, but as of now in Himachal Pradesh, government run, I am not aware of any. They are our efforts, they are making efforts to establish rehabilitation centers at the level of the government, which are funded and sponsored or managed by Social Justice and Empowerment Department. There are many private kind of de-addiction centers. I am not exactly aware how many are registered with the State Mental Health Authority, because ideally they should be a registered one.
Right.
And otherwise unauthorized de-addiction centers, if they are there, they are going to be hazardous, and of course they are going to play with the lives of people. So I think that is very important. Now what in fact what we are doing is we are treating the demand. We are decreasing the demand. Now,
very interesting, sir.
Supply is another question. Supply of the drugs and substances, if we do not check them.
Right, sir.
Youngsters, as I told you, that they are in a habit of experimenting new things, new drugs, and they come to know from their peer groups also. If the thing is available so easily, everybody would like to experiment it, maybe once or twice.
Absolutely.
And many may not come back. They may get hooked on to it. So the role of police department, law enforcing agency, judiciary, time-bound punishments and of course severe punishments as per NDPS Act and all those things, I think that should be ensured. And at the level of the government, I said that de-addiction centers as well as a de-addiction cum rehabilitation centers, there should be sincere efforts must be made into making them functional.
Right.
So that I think individuals can directly go there and get themselves treated. So it's not only doctors or because there are many people who do not come to the system.
Yeah.
You may provide a helpline also, but where to go?
Absolutely.
Right. So coming to the hospital, and there are very few people come to the hospital that way. So we are just looking after or treating the tip of the iceberg.
Right, sir.
The major chunk of it is still in the society. That should be looked at.
ये जो social justice का system है, is it also flanked with volunteering or giving them alternative modes of employment or engagement? जैसे कोई drug addict है, उनको he wants to rehabilitate and get back into life. So are there any programs run by the government here or elsewhere in the country where they are rehabilitated to the extent that they can do something more creative, more constructive in life rather than falling back on drugs?
Correct. That's a good question. In fact, ours is a small state.
Gee.
And I said that we do not have even rehabilitation centers also. In rehabilitation center, if it is well equipped and it is having all those facilities to sort of enrich and empower the individual with the profession with which he or she was engaged into earlier, they can come back fully into the society and they can be productive also. Apart from that, there are certain other kinds of, for example, Narcotic Anonymous, Alcoholic Anonymous. These are anonymous groups which are providing services to the people who are into drugs. But somehow they are also not much into it. As of now, in Himachal Pradesh, nothing much is there from the side of the government. As far as I know, because now I am not into the government system, so I don't know if there are any new programs. But till the time I was director of medical education, I think that the process was going on, but the things are not still made functional.
Right.
NGOs can be roped in, and social justice and empowerment, in fact, seek help of NGOs also. But they should be credible and authorized and certified
regulated
NGOs who should be roped into. They should not be simply taken into that simply you mint money and take the funds from the government and don't do much work. So that is the, I think, important area. So NGOs and social justice empowerment, they work hand in hand, and they should devise certain strategies for that also.
How to motivate the mind towards the positive side so that they don't fall back, number one. Number two, they look at life with a different perspective. And number three, they don't get back to same practice.
The basic purpose of education, we have got a national education policy also. In the medical colleges, we have got a new sort of a NMC curriculum also, where you are taught, ATCOM, attitude, ethics, and communication modules, which are new modules which have come up. So, developing, I think, the values and ethics and high morals and giving quality education to the students. And I think the sort of monitoring colleges and basically schools as to what is being taught there. It has been incorporated into the syllabus also, but how effectively that is being delivered to the students, and they are really imbibing it into their real life. And at the family level also, in the schools, we used to, our children used to read books like a book of moral values and all that. Are we really following those values? That is more important. If we want to work at the grassroots levels, the NEP, the National Education Policy, and things like that, I think they can be effectively utilized and monitored also in the school. Then only I think we can. And you should take it a collective responsibility. It is not that my child is into drugs, so I am only concerned. And it is the responsibility of teachers, family members, police people, judiciary, and of course the government itself. So everybody will have to work in their respective areas. Then only probably this, day by day expanding disaster in disaster situation, this can be controlled.
Right.
Because you cannot stay away from media. Media is day and night, new apps, new things are coming, new kind of strategies are being put into this. AI is now coming into the field also. So I think a lot of work needs to be done at all levels. That is the only way you can control this.
Sir, thank you so much for your valuable insights. And that's all we have today at 2 for Joy Studio. For those who are interested in knowing more and understanding this problem in detail, can give their comments. We'll respond to your comments. We also have a helpline number where affected people can call and seek help. So that is all I wanted to say in this episode. Thank you so much for watching. Please do subscribe, like, and share us as much as you can. Thank you and bye.